Hello everyone. Today we are going to discuss a very important topic that concerns millions of women around the world, breast cancer, and how a simple habit called the breast self-examination can help in early detection and save lives. Breast cancer is one of the most common cancers affecting women globally. The most important thing to understand is that early detection can dramatically improve survival. Many women ignore early warning signs because of fear, lack of awareness, or hesitation. Through this video, my aim is to spread awareness in a simple and practical way. In today's video, we will discuss what breast cancer is, global and Indian statistics of this cancer, risk factors and vulnerable groups, symptoms and warning signs, prevention strategies, screening methods, and finally, step by step breast self examination. So, watch this video till the end because the last section may help someone detect a problem earlier. What is breast cancer? Breast cancer occurs when cells in the breast start growing abnormally and uncontrollably. Normally, cells grow in an organized way, but cancer cells multiply rapidly and may form a lump or tumor. Over time, these cancer cells can spread to nearby tissues or even to other parts of the body through blood or lymphatic channels. Breast cancer can occur in the milk ducts, the milk producing glands called lobules, or surrounding tissues. Although it's much more common in women, men can also develop breast cancer, though it's rare. One important point is that every breast lump is not always cancer. Many lumps are benign or non cancerous. However, every unusual change should be evaluated by a doctor. Now, global scenario of breast cancer. According to the World Health Organization, breast cancer is now the most commonly diagnosed cancer in the world. Globally, more than 2.3 million women are diagnosed with breast cancer every year. Hundreds of thousands of deaths occur annually due to late diagnosis and limited access to treatment. Breast cancer affects women in both developed and developing countries. The good news is, in countries where awareness, screening, and early treatments are available, survival rates are much higher. This clearly shows that awareness and early detection can save lives. Now, speaking of Indian scenario, in India, breast cancer has become the most common cancer among women in many urban areas. Let's discuss some important facts. Fact number one is every year, thousands of new cases are diagnosed in India. Also, cases are increasing not only in cities but also in rural populations. Unfortunately, many women in India reach hospitals in advanced stages because of lack of awareness, social stigma, fear, financial limitations, delayed medical consultation. Another important observation is that Indian women are often diagnosed at a younger age compared to Western populations. Many women ignore symptoms like a painless lump in the breast, nipple changes, or abnormal discharge. By the time they seek help, the disease may already be advanced. This is why awareness programs and self examination are extremely important in our society. Now, let's see who is more vulnerable. Now, let's discuss the risk factors first. Having risk factors does not mean someone will definitely get cancer, but the chances may somehow increase. Increasing age is the first risk factor. The risk increases with age, especially after 40 years. Then, family history. If a mother, sister, or daughter has breast cancer, the risk becomes higher. Genetic mutations. Certain inherited genes like BRCA1 and BRCA2 significantly increase the risk. Hormonal factors, that's early menstruation, late menopause, having no children, first pregnancy at late age. These may increase exposure to estrogens for longer periods. Obesity, especially after menopause, obesity increases the risk. Lack of physical activity. Sedentary lifestyle contributes to a higher risk of breast cancer. Alcohol and smoking both increase the likelihood of many cancers, including breast cancer. Radiation exposure. Previous just radiation therapies may increase its risk. Previous breast disease, Some non-cancerous breast conditions can increase risk slightly. Men can also get breast cancer, though rare. Men should also be aware, especially if there's family history. Now, symptoms and warning signs. Now, let us discuss the symptoms first. Remember, early breast cancer may not cause pain. That's why regular examination and screening are important. Common warning signs are breast lump, a new lump or thickening in the breast or underarm. Usually it's hard, it's irregular, it's painless. But some cancerous lumps may also be soft or painful. Change in breast size or shape. Or one breast suddenly becomes larger or distorted. Now, skin changes, dimpling may occur, redness may occur, thickening, skin resembling orange peel. There may also be nipple changes, nipple turning inwards, scaling of the nipple, crusting of the nipple. Nipple discharge is also important, especially bloody discharge. Persistent breast pain. Pain alone usually does not mean cancer, but persistent pain should be checked. Swelling in the armpit. Enlarged lymph nodes may appear before the breast lump becomes obvious. Please remember, any persistent breast change should be evaluated by a healthcare professional. Now, how is breast cancer diagnosed? Diagnosis may involve clinical breast examination performed by a doctor, mammography, a special X-ray of the breast used for screening, then ultrasound, useful especially in younger women, MRI, used in selected high-risk cases, biopsy. A small tissue sample is taken to confirm cancer. Biopsy is the definitive method for diagnosis. Now, some preventive measures. Although not all breast cancers can be prevented, healthy lifestyle measures can reduce risk. Some important preventive steps are: maintain healthy weight or avoid obesity, especially after menopause. Exercise regularly, at least 30 minutes of physical activity for most of the days of the week. Eat healthy diet like more fruits, vegetables, whole grains, less processed foods. Avoid smoking and alcohol. Breastfeeding may reduce risk cancer. Regular screening, especially for women above 40 or high risk individuals. Awareness of normal breast appearance helps detect changes early. Now, the most important, breast self examination. Now, we come to one of the most important parts of this video, breast self examination, also called as BSE. Breast self examination does not replace medical screening, but it helps women become familiar with their own bodies. The best time for examination is a few days after menstrual period ends. For menopausal women, choose the same date every month. Step 1 is to look in the mirror. Stand before a mirror with shoulders straight and arms relaxed. Look for changes in size, swelling, skin dimpling, nipple inversion, redness or rash. Now raise both arms and look again. Also check for any nipple discharge. Step 2 is feel the breast while lying down. Lie down and use the opposed hand to examine each breast. Use the pads of your three middle fingers. Move fingers in small circular motions covering the entire breast, from top to bottom or side to side, including the armpit. Use light pressure, medium pressure, and firm pressure. Feel for any lump, any thickening, any hard area. Step third is to examine while standing or in shower. Many women find it easier during bathing because skin is slippery. Repeat the same circular motion and see if you notice a new lump, skin change, persistent pain, nipple discharge. Please consult a doctor promptly. Remember, most breast changes are not cancer, but early evaluation is important. Conclusion and call to action. Breast cancer is a serious disease, but when detected early, treatment outcomes improve greatly. Awareness, healthy lifestyle, regular screening, and self examination can save lives. Share this video with every female you know and see you in the next video. Peace.